Welcome to the Dylan Copilot in-service video. In this video, we will cover the steps on how to operate the Copilot video laryngoscope. We will also explain why it makes sense to perform all your daily intubations with the Copilot to provide a very cost-effective, very safe solution and to reduce the risk of infections to the patient and to the caregiver. With the Copilot, you can get it right the first time, every time. The Copilot is also a great product to replace any of your difficult airway scopes. This system was actually designed by practitioners who believe that the video laryngoscopy should be a standard of care for all intubations. In order for this to make sense, the Copilot has been designed to work with a very cost-effective disposable sheaths and a detached monitor to avoid getting close to the patient. You can use it on every intubation, normal or difficult airways. One of the very first things that I really liked about the Copilot when I found out about this product was that there's no on-off switch whatsoever on the monitor. It's very easy to turn on. You actually just engage the blade and the power comes on the monitor. You don't have to worry about pressing the button and holding it and worrying that it's going to turn back off or turn back on. It just goes on and off just very simply by engaging the blade. In addition to that, the monitor actually has a battery indicator on it built right in. The green tells you that you have actually more than 4 hours of visual viewing time left on the monitor. When it turns orange, it gives you a warning letting you know you have 30 minutes left. And when it turns red, it's letting you know there's 15 minutes left and it's time to plug it in and recharge the battery. You know, this product is affordable, it's durable, and it's portable as well. So this is actually a rubber casing on the outside. It's been drop tested, and this product comes with a 1-year warranty. So the 1-year warranty is already included when you buy the starter kit with this product. To use, you can grab one of our size sheaths. I'll grab one of our sheaths and it just slides in place and clicks in place and you'll hear it lock in. Once you have that ready, it's simple and easy. This is a difficult airway mannequin and I'm going to slide in and show you how clear the picture is. The most important feature of this product is the ease of insertion and the clarity of the picture. The next thing I want to do is use my reusable rigid stylet. With my reusable rigid stylet, you're going to slide on your ET tube and put in place. And this is designed that you can intubate very easily with a reusable rigid stylet. So the first thing I'm going to do is slide that in place. It actually has an ejection button on the top of the handle. I can put this over the trash and drop the disposable sheath in the trash. This sheath is the only part that's going to touch the patient. It's disposable, they're affordable. Once you drop that in the trash, we're going to turn off the blade. The second option is with all of our sheaths, there's actually a built-in bougie port. So now I'm going to slide this on, and instead of using the reusable rigid stylet, I'm going to use the bougie. We have a curved tip bougies that slide on our bougie port, and now we can put this in the channel. And we're actually going to have a channel deliver this bougie right through the vocal cords just like that. Now we can deliver our ET tube and have visibility as we intubate. So now I'm going to slide my bougie out of the bougie port, slide the ET tube through the vocal cords, and then remove the bougie and throw in the trash. Just like I did with the reusable rigid stylet, I'm going to take my sheath and put it over the trash and drop it in place. Disengage the blade and we're ready to go. So now if you have a COVID patient or you have a difficult intubation in the ER, the ICU, you have the ability now that you can load the bougie in place and you can actually intubate with the stylet, but the bougie can be your backup. Slide this in through the ET tube. We're going to have our bougie port loaded, and then when I go in, you have double protection on intubation. If I have problems getting my ET tube through with my reusable rigid stylet, now I can come out and I can load my ET tube on the bougie and slide in place, just like this. And once we get down to where the channel is, we're going to slide the bougie out of the channel and slide the ET tube over the bougie and into place. So it's very simple, it's very easy. Once I'm done, I'm going to drop my sheath in the trash. Our sheaths come packaged 10 per case. We cover all your sizes available. In addition, the bougies are 10 per case, and this is a universal bougie. The reusable rigid stylets are individually packed. And again, the bougies and the reusable rigid stylets can be used with any difficult intubation device. The only thing that's proprietary to the Copilot is the sheaths. So the sheaths will not work on any other video laryngoscopes. So when you buy the starter kit, you're going to get the monitor, You're going to get the 2-piece unit, which is the blade handle and the cord, the video cord. And then it also comes with the charger. So we have a very long charger cable. It takes about 3 hours to fully charge, but once you fully charge it, it lasts over 4 hours of visual viewing time. But this will lock in place, and then there's a little twist on for safety purposes. You can charge it up and then it'll be ready to go when you're ready to use it. The other choices that we have available, obviously you can put this right on the patient directly with the little kickstand that comes on the back of the monitor. The advantage of this is we can set this on the patient at any angle so that you can look at it from any angle and then it doesn't take up any space. Another option is to just buy our IV pole clamp. This will work on any IV pole that's already in the room and won't take up any extra space. This is designed so that you can flip it upside down based on the doctor's left or right-handed. So we can slip this on and then lock in place. That's how it's designed right here. I have it ready on my roll stand and it's ready to go. So this is available as another item as well. And then the third item is the black carry case. That's available when you buy our Copilot. The black carry case is great because it's portable. You can actually carry it around on your shoulder. And then you can fit everything in it. So I can put my sheaths in it, I can put my monitor in it, I can put my blade and handle, my charger. You can put your IV pole clamp in there. The roll stand is, obviously an option. And with the roll stand, you'll buy our IV pole clamp, put it on our roll stand, and then the basket is designed so you can put all your product inside. So we can put the sheaths in, we can put the bougie in, we can put the reusable rigid stylet in, and then it's all available and ready to go, and you can adjust whatever height you would like to put the monitor on. If you have any questions, please go to Dilon.com, DILON.com. This concludes our video presentation today, and we appreciate your time. Thank you.